So that's going to come up for you guys just to click and say it's okay. All right, so I've got everybody minimized, and I'll just start off with this session. So tonight we're going to be looking at havening, which is a modality which is reasonably new, only been around properly since about 2006, and it was developed by this man here, Ronald Rudin, in the States. He is a medical doctor, and he basically was a little bit interested in tapping, which is another of the psychosensory modalities, and almost came across this havening as a bit of a byproduct of his research into tapping. So the havening techniques engage our inherent biological system to permanently heal, strengthen, and empower our minds and bodies. So that's been taken from some of his work. So what is it? So it's a novel psychosensory technique. And so psycho meaning obviously that it affects the brain, and sensory meaning touch. And it activates a trauma. So what the process is that you actually ask the person to recall a trauma or some sort of distress that they have been through. And then we modulate it by creating delta waves in the brain, and those delta waves are actually generated by the havening touch, which is either applied by a practitioner, or you can actually do it yourself, or the practitioner can be on the other side of the screen and you can be doing it through this modality across Zoom as well. It's a rapid downregulation of receptors that encode the trauma in the amygdala. So the receptors that have initially encoded the trauma that the person has experienced, we're actually downregulating those receptors and allowing that trauma to be decoded. So these are some of the conditions that can be treated or even cured with havening touch: severe anxiety disorders and panic attacks, low self-worth, phobias, traumatic memories, severe depression, post-traumatic stress disorder, relationship problems, addictions, chronic illness and chronic pain, allergies or sensitivities. Now, one of the cases that Robin talked about during our workshop was when we were learning how to use this technique, was the experience of people suffering from chronic pain. And one was a woman that was sort of quite late in her pregnancy. I think she was around about 8 months, and she just developed some really severe abdominal pain. I think it was pelvic pain. And she was referred to the pain team at the hospital, and they were going to start her on methadone, which is obviously the appropriate treatment for this kind of pain. And she had already booked a session with Robin, and she went and saw him and had 2 sessions of havening and was able to find what the memory was that was associated with this pain, and it had been a traumatic event in her childhood. And by having the havening touch, after 2 sessions, the pain had disappeared, and so she didn't need to take the methadone, which was a really big relief for her. So, I mean, that's a very condensed version of what he told us in the day, but just hearing that story and, thinking about all the people that are out there that are suffering with chronic pain, then if you can do something as simple as havening, then, why wouldn't you give it a go? It can also be used for coaching, which is one of the reasons that I'm very interested in learning about it and practicing it. And it can enhance high performance leadership and development. So there's certainly big avenues for corporates to use it, and also for high performance sports athletes to use it as well. So looking at it in a context, it's a powerful standalone therapy for emotional trauma, or PTSD, phobias, chronic pain, anxiety, depression, and other problems, as I alluded to. It beautifully integrates with other therapies such as hypnotherapy, psychology, and body work. And it also has a potential role in traditional healing methods. So it certainly doesn't need to sit outside of our biomedical methodologies of treatment at all. So, it can actually sit alongside them quite nicely as well. It's a powerful method for high performance coaching, executive coaching, as I said. Then it can also be used as a self-therapy, which it helps to build resilience and well-being within an individual. So yeah, it's amazing what it can cover. Now, you've probably heard of the pillars for, we call them the therapeutic pillars. So the first one is you have talk therapy, which is obviously comes under the psychotherapy, which is our talk and transference therapy. Then your second pillar of therapies for mental distress is, of course, pharmaceuticals. And then you're in your third pillar, which is where the psychosensory therapies fall, is basically the active ingredient, which is our touch therapy, is actually an electroceutical. So if you're thinking like you've got pharmaceutical and then you've got psychotherapy, the touch therapy is actually working at that electroceutical level within the brain. And I'll explain that a little bit further into the talk. So here are some of the types of psychosensory therapies. So many of you will be familiar with the group 1 over here, which are the non-specific ones. So yoga, acupuncture, biofeedback, neurofeedback, exercise and related activities, music, light, aromatherapy, and massage. So those are all quite common types of the psychosensory therapies. Over in the group 2, which are the more specific ones, Havening I've got here at the top, there's also the EFT, which is emotional freedom techniques. There's the Callahan techniques or thought field therapy. And there's the EMDR, which is the eye movement desensitization and reprocessing. Now, I don't know a lot about those other therapies underneath the Havening one there. And I know that when I did my course with Robin, I was with a number of psychologists from the Waikato DHP because they were also learning how to use it, use Havening, and they talked a lot about EMDR. So they obviously use this as part of their treatment with people they work with. Basically, there seems to have been a quite recent discovery of the nerves that signal a soothing touch, and these are the C fiber sensory nerves. And you get a maximal response when the skin is stroked with a warm object in one direction, and a warm object is simply a hand. The nerves don't respond well if you stroke too fast or if you stroke too slow. And it gives you that nice soothing safety system. And ultimately what it does is it generates these beautiful slow delta waves in our brain. So if any of you have experienced anything like Havening and you'll find that you end up in a very, very relaxed state. For me, because we had a lot of practice in class, I had this sort of real amazing feeling, almost like being hypnotized in a sense. during the process, and just it gives me a huge amount of relaxation. I'm just going to show you, the next slide shows you the delta waves. So delta waves occur mostly in our deep sleep, and you can see them there along the bottom. So you've got your stage 3, which is your non-rapid eye movement sleep here, and you've got these slower, more spaced out brain waves. They're also the most predominant brain wave in early childhood when our core beliefs are formed. Now, up here, when you're awake, you'll see that your brain waves are much closer together. And when we have a traumatic event, or when we encounter some sort of stress, then this is actually what our brain is doing. The waves are what we call gamma waves. I've got another slide to show you a little bit further in, where they are much closer together. And that's what actually allows the opening of the synapses within the brain to have this distress encoded into our amygdala. So this is when we get a little bit more sciencey. So when the brain is slowed down and the delta waves are more prevalent, this is when we get that chemical change in the brain, and that the neurons open up and can release those encoded memories that are in the amygdala. So a bit more on that a little bit further down. So what the brain response is that to havening is that you get increases in your delta waves, and then the delta waves allow the AMPA receptors, which are amino hydroxymethyl isoxyxylopropionic acid receptor. So they're often called AMPA receptors or AMPAR receptors. And they're an inotropic transmembrane receptor for glutamate that mediates fast synaptic transmission in the central nervous system. So this is where we're deleting these AMPA receptors, and it allows us to erase any traumatic memories that have been encoded in there. It also increases our GABA, which is an amino acid. So it's GABA amino butyric acid, and it functions as a primary inhibitory neurotransmitter for the central nervous system, and it functions to reduce neuronal excitability by inhibiting nerve transmission. So GABAergic neurons are located within the hippocampus, the thalamus, the basal ganglia, hypothalamus, and the brainstem. And the balance between inhibitory neurotransmission via GABA and excitatory neurotransmission via glutamate is essential for proper cell membrane stability and neurological function. So these are fairly important amino acids within our brain, and we're able to have quite an amazing impact on them through havening touch. So the other side benefit is that we increase serotonin, which obviously really helps in elevating the mood of those people that might be low in serotonin. It also allows for incorporation of new memories and new beliefs, which is why, when you're talking about using it for coaching, or for me using it in coaching, that I will be working on people talking, about their self-worth and overcoming the barriers that the brain often puts up when we are attempting to try things for a first time or something new. So havening touch not only depotentiates the AMPA receptors, but it also increases resilience. So that's another nice side effect, is that you will become more resilient after a havening session. So the primacy of human touch for our well-being is incredibly important. So touch is the first sense to develop before hearing, smell, or taste. Skin-to-skin contact has many benefits for the newborn. Now, I worked in NICU in my early days of nursing, and one of the things that we did a great deal of was, getting really tiny little babies out of incubators and putting them onto their mums or dads for skin-to-skin contact. And actually, recently I was up in NICU and I saw it happening with some really premature twins. Dad had two of them down inside his shirt. And so this is, really, really important, knowing that touch is that first sense to develop. Our skin is our largest sensory organ, which is, fantastic. And if small children are touch deprived, they are developmentally delayed, both mentally and physically. And I'm sure we've all seen those horror stories of the children that have been kept in orphanages, and deprived of touch, that they can be really, really developmentally delayed. Soothing touch increases oxytocin. Yay, we all love oxytocin, dopamine and serotonin, and reduces stress hormones such as cortisol. All amazing hormones that are circulating naturally in our body. But if we can do a little bit to actually increase those happy hormones like oxytocin, dopamine, and serotonin, then yeah, it's got to be good for you. Touch conveys emotions and support, and often more powerfully than words. Sadly, touch has been removed from a lot of our clinical care and therapy. So it's not really seen as a done thing to touch people when we are working with them. And I think perhaps it's something that we could look at reintroducing. I certainly know that in my experiences as a nurse, that touch can have a huge impact on someone who's feeling really unwell. So I know that people I've worked so far with Havening, I've had about 3 or 4 say, oh, not sure whether we like being touched that much. And so, it's quite important for me when I begin to haven with someone that I demonstrate it in a very non-confrontational way, and then sort of ease a bit closer to the person, really slowly, because you are very much getting into their personal space, which people don't always like that much. So the next few slides, I'm going to show you the actual facilitated havening techniques, and these are all you need to create the highest levels of delta waves in the brain, and they're kind of really intuitive anyway, and you won't have any problem with knowing what they are. Pardon me, dinner coming up. So facilitated havening touch, which is applied by the practitioner. So as you can see, it's going to be a little bit hard with my glasses on, but what I tend to do is come right around the edge of the hairline, down over the cheeks and around the jaw. And that's just a continual motion that occurs like that as you come down. As you can see, it's quite an intrusive, like you're up close and personal with the person. So you just got to be aware that before you even go to touch the face, that the hands are clean, and that you say, I usually demonstrate it on myself and say, this is what I'm going to be doing on you. Then across the cheeks, so coming across the, often I'll do it on the other side of the fingers and coming across there. And most of you will know that, or I have memories of when I was little, and my mother, if I was sick or lying with my head on her lap, that she would stroke the side of my face, and that always just felt absolutely amazing, especially if you had a high temp or you were just feeling really lousy. Now, the palm havening, I'm not sure whether you're going to be able to see me on camera, but it's actually a downward stroking of the hand, so down like this. And so when I'm working with a person, I have them with their hands out flat, and I stroke downwards like that to get the palm havening. You can do it yourself as well. So this movement for you, if you were doing it yourself, is what I would encourage you to do. And we'll have a little bit of a practice at the end if you want to. And then the last one is facilitated arm havening, which is basically giving yourself a really nice hug, okay? And again, it's a downward movement at a reasonably firm pressure at this kind of pace. This is the pace that I would work with someone on. Again, I'm doing it in front of them, so I'm stroking down their arms, and I'm not in front of them, I'm sitting to the side and stroking downwards on their arms. And what happens is there's no like right number of strokes to do, or basically you just go with the flow. So it's pretty easy. So, I might start with the hands, move up to the upper arms, come up to the face, around the face a few times, across the cheeks, and then I might go back down to the arms, or I might go straight back down to the hands. And that's the best way. And what you find when I've been demonstrating with people before I started, I talk about how we sometimes rub our hands down our thighs, and that might be when you're feeling a bit nervous, or you're sitting somewhere, or you're simply trying to warm your hands up, that you'll rub down your thighs. And I think that actually feels like a bit of self-havening as well. So as I said, we have the three types. So you've got facilitated, which is when the instructions and guidance are provided by me, the practitioner, and I apply the havening touch. And then you've got facilitated self-havening, which is, again, I'm giving instructions and guidance, and the client applies the havening touch. And then self-havening, client might follow a set of written instructions, and then the client self-applies the havening touch. So it's really simple to do all of these. This one here is I would find easiest to do online over Zoom, and it works just as well as it does in person, which is this one. So what actually happens in the brain? Why do we have these traumatic memories? What is their function? What parts of the brain are involved? What happens when we get traumatized? What's that basic neuroscience? And what's the neurophysiology of that traumatic encoding? What can traumatic memories, well, how can traumatic memories be erased in minutes, and how does havening work? So let's go a little bit deeper into it. So trauma exists. The world's a dangerous place, and we have multiple mechanisms to actually keep us safe. So we have reflex responses to pain. I mean, if you put your hand on a hot element, you want to be able to lift it off when it hurts, because you don't really want to have it stuck there burning away. We get obviously any irritation. So we get itches, we have a reflex response if you ingest poison, if there's a sudden sound that you might get a fright, you have a reflex response if you fall, or if there's an approaching missile, when you go to dodge something that's coming at you. Then we have the immune response, which is obviously our body's way of fighting off infections and foreign bodies. And we have an emotional system, so fear and anxiety responses to potential threats, and these actually might include learned threats. So all systems produce rapid automated responses, often without us knowing what's happening, and all include learned responses, so they all have a memory. So an example here is our immune system. So the first exposure to an infection creates a molecular memory, so we produce antibodies, and a cellular memory. So we have a continuous system then going in our body, scanning and looking for any other infections to attack. And we have rapid automated responses to reinfection, and we can become overreactive, which is when we get allergies, or we can have it cause us a collapse, anaphylaxis, and it can start to attack itself. So it might become like an autoimmune disease. So that's our immune system example. So if you think about the amygdala, the next slide I'm going to show you actually has a picture of where the amygdala lives, is an emotional immune system. So what it does is it remembers threats. It's our continuous surveillance system in our brain. It has an immediate response. It can also be overreactive. So when we suffer from anxiety, panic, or phobias, it can cause collapse. So severe distress can cause us to actually collapse. It can attack the self. So sometimes, we can have shame and self-criticism. A lot of the time I talk about, our inner critic that can be incredibly harsh on us. And then trauma is encoded in the lateral body of the amygdala. So it gets hardwired in there. So here we've got the limbic system of the brain. Now, most of you know that it's the primitive brain. Some people call it the monkey brain. And in here we've got the hypothalamus, which is responsible for our autonomic and endocrine systems for our survival. So fight, flight, feeding, and reproduction. Then we've got our hippocampus, which is responsible for our memory and identity. And then the amygdala, which is that little wee bit right in there, is responsible for integrating emotions and responses. So whether they're physiological and behavioral. Okay. Now, sometimes, certainly with the reading I've been doing around havening, we've also the cortex of the brain, which is up here, which is our bigger frontal part of our brain up here, can also be considered to be part of the limbic system. However, it's sort of for where havening works, that it's definitely works on the amygdala and in the neurons and the synapses within that part of our brain. Okay, so when I'm talking about thinking, I'll often say, where our sympathetic nervous system is housed in this limbic system, our parasympathetic nervous system is housed in our cortex of our brain. So that's where much more of our thinking or our rest and digest part of our central nervous system lives. So what happens in the brain when we get traumatized or distressed? We create a hardwired memory. Every element of the scene, the sight, the sound, the smell, the touch, the taste, all get into that memory. And our internal body reactions, our emotions, thoughts, and feelings and pain are also encoded in there as well. So what stimulates the fear response? Now, the information arrives through our senses. So the next slide here shows you we have our sight, okay, our eyes, sound, our ears, touch, obviously our skin, and taste, all go through the thalamus and either go to the cortex if the sensory input is not perceived as threatening. If it's perceived as threatening, it goes directly to the amygdala. Okay. However, if it goes to the cortex and then the cortex decides that it is threatening, it has a route through to the amygdala as well. Okay. Now, the only sense that doesn't go through the thalamus is the sense of smell. And so that goes straight into either the cortex if it's not threatening, or into the amygdala if it's threatening. And I think that's quite pertinent, like, when you hear about people smelling smoke when they're asleep, that basically is one that will wake us up to get us out of a burning house. So yeah. So the vision input signal is via electromagnetic and then electrochemical. And so when you think about these, all the notes on that. So we've got the vision is electromagnetic, hearing is vibration of ear, but where they all end up as transduced signals and they all become electrochemical in the end. So smell and taste is chemical and then it becomes electrochemical. Touch is mechanical, then becomes electrochemical. Visceral, so mechanical, chemical, electrical, becomes electrochemical. Kinesthetic, mechanical, and thought, electrochemical. So that's the one that basically goes into an input signal as electrochemical, and as a transduced signal as electrochemical too. So yeah, the brain is such a complex thing. So just a couple of pictures here to show you what happens in our body when we are exposed, like when our sympathetic nervous system is responding. So, you know, the body does some amazing things for your eyes. You get tunnel vision. The brain signals to the adrenal glands to reduce, put out cortisol. You've got your ear, so you get a much more heightened sense of hearing. The heart rate accelerates, you get fast breathing, your muscles tense up, your liver converts glycogen to glucose, you might get relaxation of the bladder, your hands shake and sweat. Adrenal glands obviously produce the hormones down in the kidneys. You get in your stomach, you get much slower digestion. And this is all really to protect you so that you are able to fight or flee, okay? And here you've got your cortisol, which does all these things as well, which is increase your blood sugar, heighten memory and attention, increase in blood pressure, decrease sensitivity to pain. And often people say that when they've been badly injured, they don't feel the pain. Decreases serotonin though, which is not great, and it suppresses the immune system, so it's not going to fight off bugs. And unfortunately, in modern day life, a lot of people are actually experiencing high rates of cortisol just as a byproduct of their lives. So deleting traumatic memory is one element of many different havening techniques, because there are others. So it rapidly relieves acute distress or panic and helps the client let go of a burden of negative emotions. Talk havening is another one. So it gains deep insights into the causes of trauma and life difficulties. Reparenting the wounded inner child is another one. Preparing clients for future events so they feel safe and confident. Building new positive self-beliefs such as self-worth, treating chronic pain and chronic stress, fatigue and illness, and teaching self-havening techniques for resilience and well-being, as well as others. There's affirmational and affirmational and transpirational, all sorts of different ways of havening techniques. And here, this is just a slide which I thought was quite interesting, because what you're looking at here is the whole polyvagal theory. So you've got your freeze up here, which is that really nasty parasympathetic nervous system. So we've got here, not nasty sympathetic nervous system sitting in here, and you've got your parasympathetic ventral vagal, and you've got your dorsal vagal up the top. Okay. So really what we want to be doing is living in this nice green zone down the bottom and spending very, very little time in this red and blue zone up here. Now I'm going to play you this and hopefully it'll work. Can you shout out if you can't hear it?
Humans, like all species, have self-protective mechanisms to help us survive. Our fight, flight, or freeze survival response, the FFR for short, is designed to mobilize our brain and body to fight an enemy, run from an misinterprets safe situations as dangerous and sets off false alarms. When the amygdala, our brain's watchdog, senses and barks danger, our body enters survival mode quicker than our rational mind can react, leaving it trying to figure out why we feel in mortal danger. When the FFF alarm is sounded, we start to breathe more quickly and shudder, causing hyperventilation, and our heart starts beating very fast. These changes can cause strong chest pain, which many people interpret as symptoms of a heart attack, when in fact it's just a result of the FFF activation, which can be relieved through breathing exercises. As a way of getting you ready for action, blood is diverted towards the major muscle groups. Blood flows away from our digestive system, causing the bladder to relax, and we might feel the need to pee. The mouth goes dry, nausea can occur, and we get a butterflies feeling in our stomach. Blood also rushes from extremities, leaving us with cold hands, but often sweaty palms as the action-ready body starts sweating to avoid overheating. Legs and hands can start trembling and feel weak, while tension starts building in big muscles like the thighs, neck, and shoulders. In our head, FFF alarms cause our brain to focus on negative memories, probably so we can scan them to avoid danger and negative outcomes. We get tunnel vision as our pupils dilate to increase our focus and long vision, but as a result, we lose our peripheral vision. FFF activation also reduces our ability to recognize differences in facial expressions. Too much oxygen and too little CO2 can result in dizziness or lightheadedness, which many people interpret as signs that they might faint. But because fainting is caused by a drastic drop in blood pressure, and because the FFF increases both our heart rate and blood pressure, it's nearly impossible to faint when this happens. Over time, depression, anxiety, and high levels of stress all harm the brain's ability to slow or cancel false FFF activations, causing them to happen more often. Knowing the symptoms of false activations makes it easier to recognize and reduce their effects. At Therapeutic, you can learn both bottom-up and top-down techniques to reduce false FFF activation and bring your body back to balance.
So, when we're looking at a traumatic memory or a distressing event, there is an intense emotional response, and we get a high level of gamma brainwaves, which cause a change in the neurochemical levels in our brain. It can be second person witnessed or even third person told, and we get rapid encoding into the amygdala, the brain. Now here is a picture. So here we've got the line across the top. Sorry, it's a little bit cut off there. So we've got our gamma waves that go in a range from 31 to 100 hertz, and they're very, very close together. Okay, so we get our peak focus and expanded consciousness up here. Now down here are the delta waves. So this is where we have a much more detached awareness. This is when our healing occurs, and it often is when we are asleep. So what havening does is create these within your brain while you are being havened. So that's the delta waves that I was talking about. Now, for us to obviously have a memory or a distressing event encoded into our brains, we need to be exposed to what was called an unconditional threat stimulus, okay, so or a UTS. And these are pretty innate, okay? So the ones here are the most common ones that you will come across, so abandonment, attack or threat of attack, somatic pain, heights, suffocation, being trapped, open spaces, predators, creepy crawly things, darkness, and nightmares. Okay, so what you've got here is the requirements that we might need to actually encode an event after being exposed to something like this, okay? So if I'm thinking about some of my traumatic memory events in the past, it might be, I know I've had one experience where I had conflict with my husband, and I think what it actually came down to was that real fear of abandonment, that it triggered the response in me that he was going to leave. And so, yeah, and that was just immediately where my brain took me, although, of course, it wasn't true. For me, I was also, I remember being left at boarding school. So here is my abandonment distress for me. I was left there when I was 12, and my mum got on a plane the next day to go back to Western Samoa, where her and dad were living. And I was left at boarding school. And I remember vividly, like the room, the smell, and all those sort of things that happened on that day. Also, another one for me was I had a little bit of a problem driving at night after having a car accident on a dark night after leaving Mystery Creek after a netball game. I managed to collide with a car. Luckily, was not quite side on. He clipped the front of me, but he wrote my car off and pushed me into a ditch. So, yeah, luckily I was fine. My daughter was in the car though, and just lots of things after that I was fine on the night, but obviously the memory got encoded into there. And what we might talk about later is, maybe some of the examples of your triggers or phobias and what they help us to understand the actual content of how trauma gets in there. The other thing that I want to just make you aware of, that the permissive landscape of the brain is quite important. So first of all, we have to have an event for a memory to be made. So the 4 requirements for a traumatic encoding are an event. There has to be some meaning associated with that event. The landscape of the brain needs to be vulnerable, and there needs to be a perceived inescapability that you're not going to be able to get away from it. And the whole permissive landscape of the brain is probably the most interesting part to me, is that a vulnerable landscape basically is amplified by being overly empathetic. Now, I come across a lot of people who are empathetic, and I know that I'm one, having low self-esteem and in general experiencing difficulty regulating the level of emotional responsiveness. So individual traits such as obsessive compulsive personality disorder, anxiety, introversion, and addictive tendencies also increase risk. So they make you vulnerable. The stress is caused by poverty and low education levels, independently increased vulnerability for traumatization. And early childhood trauma also increases the risk of future traumatization, including having parents with emotional disturbances. Thus, in the treatment of current trauma, we always have to seek out what's happened in earlier events that might predispose a vulnerable landscape of the brain. So the characteristics of a traumatic memory are that it's permanent and it remains biologically active, causing alterations of basic neurochemicals that alter perception and response. So certain components of the memory are retrievable, while others can be disassociated and then can be newly recalled after healing. It's synaptically encoded in the amygdala and arises from the recognition of an unconditional threat stimulus, which I just spoke about. And that stimulus, the sensory stimulus, or the triggers, are similar to the initial event and can activate the originally encoded pathway, causing the release of stress hormones. And this pathway is often activated without conscious awareness and increases susceptibility for future trauma. So I was working, I might just touch you a minute. I was working with someone this week, and she has a needle phobia, and she was going to have a blood test, and she felt very like she just was super paranoid. She'd been terrible when she had gone to have her COVID vaccines, and so her response was that she was getting all the physical responses to thinking about going to have this blood test. And so we worked together, and as soon as I got her, so the first part of working with someone when you do havening is to ask them to recall an event. They don't need to tell you what that event is. However, they have to recall it and close their eyes and visualize and really immerse themselves in the event and feel the feelings. So the response that she got by doing that actually caused her to get the physical symptoms. So she started having sweaty palms. They were really cold and clammy, and her heart rate increased. And she really, because that was so traumatic for her, even the experience of going back into that memory was enough to bring up all those physical symptoms for her. And so we probably worked together for close to 45 minutes. And I think when we start with havening, I ask whoever I'm working with to give the event a score out of 0 to 10, and this is a subject unit of the stress score, and just using a scale is the easiest way to get a number for it. So the first number that I got was 10, this person gave me was 10. And by the end of probably about 3 or 4, I think we did 4 rounds of havening work. And during the havening, I'm using distraction techniques. So, talking about things that might be interesting to the person, taking the person alphabet shopping, going magic shopping, climbing up hills, walking along the beach, doing all the sort of things that are likely to distract the mind from thinking. And I think I got the score down to about a 3 or 4. So didn't really get it down. Like, I really like to get the scores down to 0. See, 0 to 1 being the ultimate result for me. But I think with this client, I would need to get her back to do more than one session to make sure that we were able to get that needle phobia down a lot lower. So I'm going to stop